Come on in. Welcome to Opening the Door to Diabetes.
Welcome back, I'm Stephen, and I'm here with Dr. Hugh Tildesley once again, and today we're going to be learning about type 2 diabetes. So, quite simply, what exactly is type 2 diabetes compared to type 1, which we learned about last time?
Type 2 diabetes is a different disease, but it's associated with high glucose levels. And the high glucose levels are in association with something called insulin resistance. In other words, these people are making insulin. In fact, there's supraphysiologic levels of insulin. The insulin levels are very high, but it's just not working. There's a blockage. Okay, so it's lost its effect. But somehow the glucose is wandering up higher, and it's wandering up higher because the molecules are not getting into the cells because the insulin isn't as effective. We call that insulin resistance.
What is the part of the body that's insulin resistant? Is it the cells?
Yeah, so basically all of those cells which take up glucose with an insulin molecule being a moderator for that, being the liver, kidneys, and muscle, do not react as well with the insulin that's circulating around the body. So even though you have measurable insulin in your body, the glucose still isn't getting into the cells.
Okay, I think I understand. In one case, your body would be failing to produce insulin, which your body needs. In another case, your cells would become insulin resistant.
Great.
So what are some of the first things you'd notice if you're seeing signs of diabetes?
Yeah, great question. And there are differences in how type 1 and type 2 present. So type 1 is when you've lost your ability to make insulin, so you're absolutely insulin deficient. Type 2 diabetes is a much more slow-moving disease in that over time you progress from having no normal sugars to impaired glucose tolerance to frank diabetes, and that may take a number of years. It's usually associated with age, with being too heavy, a strong family history of diabetes, and a lack of exercise. It is a real sleeper because many people with type 2 diabetes don't know that they have it. They may not feel quite right, but they don't have the spectacular weight changes, drinking, peeing, hunger that the type 1 patients have. So it's sleeping there. And even though they haven't been diagnosed that they have diabetes, what's happening is that the sugars are higher than normal.
So what are some of the complications that arise from type 2 diabetes?
Just think of type 2 diabetes as accelerated aging.
Okay.
So it's accelerating changes in the eyes like cataracts, accelerating cardiovascular disease, accelerating your chance of stroke, accelerating renal dysfunction or the kidneys not working quite right, or accelerating peripheral vascular disease, in other words the circulation to your lower limbs not working properly.
All right. It's a lot clearer to me now.
Good.
So, here's what I've learned. Type 1 is sometimes called juvenile diabetes because it usually presents with acute symptoms before the age of 30. It's caused by an autoimmune reaction, which stops the body's production of insulin. Type 1 isn't preventable, but it can be treated by giving the body the insulin that it needs. Type 2 diabetes makes up 90 to 95% of all diabetes cases, and it's often called adult-onset diabetes because it slowly develops symptoms over time in adults, usually over the age of 30. People with type 2 diabetes become insulin resistant, often in association with obesity, advanced age, and a family history of diabetes. Type 2 can be prevented and treated by maintaining a healthy lifestyle and body weight. In addition, insulin and various diabetes medicines are often prescribed.
Thanks for joining us, and stay tuned for our next video.